It is Thursday, October 16th, 7 o'clock. This is the Duxbury Board of Health, and pursuant to Chapter 2 of Acts of 2023, as amended on March 28th, 2025, this meeting will be conducted by remote means in accordance with applicable law. The meeting being recorded may be viewed at another time by visiting the localscene.media/Duxbury for information about Duxbury programming and watching replays on Duxbury YouTube. You can click the link that's in the agenda. All right. Our first order of business is the public health nurse update on communicable diseases.
Oops. So Kathy sent me her monthly stats, which are from September 17th through October 15th. For COVID-19, over the age of 18, there were 4 cases total. For Lyme, there's 2 probable and 2 suspect for 4. There was 1 case of yersiniosis, 1 case of Campylobacter, 1 hepatitis B, 1 human granulocytic anaplasmosis, and 1 salmonellosis. And that was it for the month for those.
Okay, great. Thank you. I think the COVID year over year is decreased. Would that be accurate?
Yes, and I think that people probably aren't going to medical professionals where it would be registered in Maven, so we're just not going to see it as much. Probably a little bit of both.
Okay. Official Maven COVID cases are down year over year. How about that? All right. Any questions? All right. Our second item on our agenda is the discussion with the Duxbury Safe Water Committee regarding concerns to the town's public water supply, and this is a continued discussion.
Right. Thank you. The committee met about 10 days ago, and the Water and Sewer Advisory Committee member gave the report to me to hand back to you. It's in design process for the Tremont Street wells connecting to the Depot Street wells. It's expected to take a long time. They have to also test for manganese and iron in those wells, and they have to treat for them. Otherwise, they'll clog up the filters for the PFAS, and the filters will then be not as effective and have to be changed more often, which is very expensive. So that's about it. The town water advisory enterprise account, the town enterprise water enterprise account is going to be totally bearing the cost of this project. And the water rates have gone up. They are going to be billed 4 times a year. And I think as the project goes forward, the water rates will have to sustain what they have to borrow to carry that debt service for approximately 20 years. But when they get those first 3 wells on PFAS mitigation treatment, they will be looking at possibly other wells that need to be added depending on the demand, but they do expect to see the water demand to decrease somewhat. Now, the other piece was that the McNeil dump, Weston and Sampson is supposed to give the select board an update on where they are with the design plans or the plans for capping that dump, which is under DEP directive. So we're waiting to hear what they present to the select board on the McNeil dump. Capping that dump will deter continuous flow into the aquifer. It won't stop what's there, but it will deter continuous flow into the aquifer.
Have we been successful? I know we talked about grants, within the last 6 months, and just wondering if we were successful in getting any of the grants to be resources for some of these projects.
I do not know. Perhaps the select board member here may be able to tell you, but I'm not aware, and none were discussed at all at our water committee meeting about 10 days ago.
Okay.
Karen, I don't have any updates on grants specifically, but the landfill capping process and progress will be reported on to the select board this Monday upcoming. So if anybody is interested, please come or watch the video.
Well, thank you. Other questions for Ms. Chin? Okay, thank you. Going on to our third item on our agenda is the discussion with the Duxbury Nuclear Advisory Committee on study results, which are soil and indoor radionuclides related to the Plymouth Pilgrim Nuclear Power Plant area.
Mary Lambert just came on, and I think she's the most qualified to speak on this. She just needs to unmute her mic.
Okay.
You all should have received copies of that study and the synopsis of it. I sent them along to Lauren, and she said she would forward them onto the committee so you'd know what we were talking about. Okay.
We received them.
Mary.
Thank you.
Maybe you could skip over and to the next topic and see if Mary can unmute herself and come on.
Yeah, I'd be happy to go to the next topic. I think this might be a bit of a discussion, but that's fine. Special topic, Kratom.
Okay, is her audio on now?
Oh, we can hear Mary.
Okay. Sorry, we're going to go back to the discussion with the Duxbury Nuclear Advisory Committee with Mrs. Lambert.
Hi, apologies. I seem unable to get on. So I hope I'm on at least on audio. Oh, here I am. Oh, hello. Can you hear me?
We can.
Yes.
Oh, good. We sent the study, pilot study, I refer to it, to you and just thought we'd get on the agenda in case you had any questions. The study, as you saw, had a very small number of samples. And so there's no definitive takeaway, except that it found what we all know, going back, cripes until the 70s, that there has been off-site deposition of radionuclide materials that are connected specifically to the operations of the Pilgrim Nuclear Power Plant. From the study, and I talked to the main author, Petros Koutakis, I think I'm pronouncing it properly, and as he said, we did find radioactive material connected to Pilgrim in the soil, house test. The closer you were to Pilgrim, there was a 20% increase. Now, and I asked him, I said, well, 20%, what meaning does that have? And he said, unfortunately, we would need more studying, and Harvard is not having great success in getting grants to do more studies. And so we would have to wait to see what happened. I had a long conversation with Dr. Richard Clapp, who did the original studies going back to the 70s with a doctor from Brown University on the potential effects of living by Pilgrim during operations, because the operations were particularly troublesome, opening up with defective fuel and also not having their off-gas treatment system in place. And so that was the case during the 70s. When they got their filtration system in place, they blew it in the 80s, in 1982. And so there were considerable deposition, which encouraged the Department of Public Health to do really a good case-controlled study, finding in communities Marshfield, Duxbury, Kingston, Plymouth, a fourfold increase in leukemia, which was the only disease that they studied. And since then, although recommendations were made for further studies, politically that did not happen. And so the question is, what we are seeing, or what this small study saw in soil, the assumption by both Dr. Clapp and Petros Kotasis, who did the most recent little pilot study, was that the deposition was due to operations. From decommissioning, what you would expect to find is some releases from the spent fuel cast, and also releases from the evaporation, which Holtec has been doing since they bought the plant. That so far, about 1,200 gallons of radioactive contaminated material has been evaporated, and they are continuing to evaporate unfiltered material 24/7. However, lucky for Duxbury, most of the winds blow towards Cape Cod. So we have two other places to look. One is the cancer registry that went into effect because of Dr. Clapp, who was the founder and initial director of the Massachusetts Cancer Registry, has shown a continuous increase in radio-linked diseases, particularly in Plymouth, continuing to today, largely thyroid cancer and multiple myeloma, and some in Duxbury, but not as much. You probably look at the cancer registry yourselves, I expect. Duxbury had 2016 to 2020 non-Hodgkin's lymphoma above statistical expectation in females, and non-Hodgkin lymphoma. The environmental factors are pesticides, which we've read in the news recently, and also radiation. Plymouth, leukemia, thyroid, brain, 2011 to 2015. Duxbury, multiple myeloma, which is a radiation-linked disease. Plymouth, again, thyroid, 2010 to 2014. Duxbury, multiple myeloma. These are above statistical expectation. Plymouth, thyroid, 2009 to 2013. Duxbury, non-Hodgkin lymphoma. Plymouth, thyroid in all sites, 2008 to 2012. I mean, I don't have to read all these. You all, I'm sure, go to the cancer registry and look at the town-by-town reports. We would expect that these radiation-linked diseases, probably due to the heavy releases during operations, and they take time to cook. And also, the second place you would look would be to the Mass Department of Public Health's monitoring report, environmental monitoring reports, specifically to Pilgrim, and the nuclear regulatory monitoring report specifically to Pilgrim. According to MDPH, and we have, as you might recall, a radiation monitor at the harbor that also has a meteorological component to it, which is very important. And so far, according to MDPH, there have been no radiation indicators at levels of health concern. So I think that's an important thing to consider. They had a monitor at the Gurnet but that has been discontinued because they found it a sort of a pain to get there. Mass Department of Public Health has real-time radiation monitors a half to 1.5 miles from Pilgrim. Then they have an additional at downtown Plymouth, Colony Place, and again, the one at Duxbury. So I think we try to keep track that these monitors are being calibrated and what the results are. So I probably bored you to death, but anyway, that's a report that we have. And what our point was that had you seen the study, you might have some questions, and I'm sure Becky could have a lot of points that I've overlooked in the effort not to take too much time. Becky?
Questions? I would like to note that at the monitor that Duxbury has at the Harbor Masters location has only been around for about 15 years. It was not there in the beginning, and we had to fight tooth and nail to get that monitor. So we only have the data from that monitor going forward.
Do any of you have any questions or any information you'd like by email?
I appreciate you sending the study. I appreciate you telling us that nothing's registering so far. I realize there's only one place it can register, but that's a comfort. So thank you for that information.
Yeah, particularly because for my study, I look at the reactor.
Mm-hmm.
But good news, there's certainly far less during decommissioning, certainly, than during operations. However, our concern as a committee, the concern of Department of Public Health and other people who focus on this issue is the spent fuel cast. That we have 62 that are on site, will be on site essentially forever. Each cask was designed for short-term storage, is subject to corrosion, but more importantly, it's subject to a terrorist attack. And each cask has half the cesium-137 that was released at Chernobyl. So if something happened to those casks, particularly a terrorist event, we would never be coming back. And so we are, as a committee, working with others, hoping for some off-site solution. There is also enthusiasm in our state government for nuclear power now, and the owner of the site is interested in putting new reactors there.
Can you hear me? I'd like to ask a question.
Sure.
Okay, sorry, I was having some audio issues earlier. What is monitored at the harbor master in the harbor versus what is in that study that you shared? Would we be able to look at, I assume that the data shared in the study is based on, some significant laboratory testing, so that's not what we would be picking up in at the
Right, because they pick up gamma, period.
Okay.
And so it's not the same. I know in their study, they did take samples in Duxbury in properties fairly close to the water, and they were included in the findings. And so that was more
Great.
detailed.
Wonderful.
But not to the extent of what was found in the Manomet section of Plymouth.
And the right now, the hypothesis for that study, or the working hypothesis, is that this is from the operations of the plant, not necessarily the decommissioning, but we don't know, correct?
Yeah, they didn't come with labels on them, you know, my home
Sure.
is. But the clear supposition, particularly because of the length of time and the half-lives of what they found, that it was clear from the half-lives it was from Pilgrim, it wasn't from a China test bomb or, you know, Fukushima. But they could not say you were from evaporation, you were from a spent fuel cache. They assumed and still assume. And so did Dr. Clapp. No, these are from operations.
Okay, so maybe from from decay of the particles, could they say anything about the age, perhaps?
I didn't ask what the age was, but the assumption was that these came out of the stack and that they were the result of operations.
Thank you.
And when you think about it, the prevailing winds are towards the Cape, number one. Number two, it's in the summertime in the afternoon that you get the sea breeze effect, where offshore then comes onshore. But that is only during the period that the land warms up. Know what I'm saying? I mean, if you go to the beach, yeah, you see it yourself, that there's an offshore breeze in the summer, and so you get all the goddamn greenheads, and then in the afternoon, the wind reverses as the land warms up, and you say, thank God, no more greenheads. But that is how the winds flow. I know this isn't about greenheads, but I was making it simple. Any other questions? Or anything, you know, would like to do. Anything we hear, we'll just pass on via email. And if you're interested or have any questions, then, you know, get back. I'm more than happy to join any meeting. And we, like you, hope we won't be talking to you anytime soon.
Now, we appreciate you keeping us informed and sending us the study. So much appreciated, and thank you for your time this evening.
Oh, hey, look, thank you. Appreciate it.
Thank you.
Other questions or comments before we go on to our next agenda item? All right, going to our fourth agenda item, which is a special topic, Kratom.
Okay, thank you. I decided after speaking with you, the board, that this is sort of a topic that's come up in a lot of boards of health in the state. In particular, Kingston, where I live, they had the discussion, they held a public hearing, and then implemented their own rules, supplemental rules and regulations. So for us, I thought it was important to bring before you to sort of start the discussion. And in doing so, well, to start off, I'm going to share my screen with just, I know I sent it out to you previously, but it's a fact sheet from DEA that sort of talks about what kratom is, where it's from, what it's used for, how it can be abused, and what the effects are. So, just in short, kratom is a tropical tree native to Southeast Asia. Consumption of its leaves produces both stimulant effects in low doses and sedative effects in high doses, and can lead to psychotic symptoms and psychological and physiological dependence. Kratom leaves contain 2 major psychoactive ingredients. I'm not going to read those, but the second one, I guess they call is 7-OH. And these leaves are crushed and then smoked, brewed with tea, or placed into gel capsules. Kratom has a long history of use in Southeast Asia, where it is commonly known as thang, cacuum, thom, ketum, and bayak. In the US, the abuse of kratom has increased markedly in recent years. So I don't want to read the whole page because there's a lot of information, and I know there are people on that sort of would like to speak to kratom as well. But in my research, I reached out to our Sergeant Homestead, who's on our meeting, to find out if he's seen any issues with kratom. And he let me know that one of the stores in town was selling it. So I went out and did a little more research to find out where else you can get this product in Duxbury. And out of our 7 establishments that I kind of correlated it with tobacco or convenience store. This is Duxbury Package Store on St. George Street. So they have a little kiosk. And I will say 3 out of the 7 stores that do have it in-house all state 21 and over to buy it. And so this is a little energy drink sort of product here, Duxbury Package Store. This is in Hall's Corner Store at the Rotary. They have the same product. And then this is Noria. Noria has a different sort of drink. They also have capsules and tincture, all for sale. So that was my little recon. I let everyone know that it's going to be discussed at our board meeting and sent the Zoom information if any of them would like to come on and speak. I don't know my screen. But that's sort of where I'm at. I just wanted to bring it to your attention so that you know that it is something that's in Duxbury, and it's not regulated by federally at all.
So you're saying you saw it in how many of the convenience stores?
3
Three
out
of
of
three
our
of the
7.
6.
3 out of
3
7.
out of 7. 3 out of 7. Okay. And we don't think it's anywhere else, just in these convenience stores?
Yes. The only other place I could would be like Brothers, and they don't even sell regular bubble gum, so they don't have any products like that. So it's strictly from what I've found are sort of convenience store, gas station type stores.
Yeah.
And some of them had never even heard of it. I know Osborne's, they didn't know what I was talking about. So
So how are these behind the register, or is there a end
No.
cap or?
yeah, sort of like an end cap counter display that had them.
Okay. All right. Well, thank you for your research. That's very helpful.
Oh,
Can
sure.
I ask a question? And so the products that they're selling, is this just the leaf or an extract or what? I'm not quite sure what it is that they're
I'm still
offering.
learning myself, but it's sort of, I guess they're calling it like a supplement. I'm just reading the back of it's a drink, and
Okay.
let's see, it's plant-based herbal supplement, kava root and leaf kratom. Consume responsibly is all it says on the container, and then on the back, it lists the ingredients, and then directions say only take 1 ounce or half of the bottle at one time. Do not exceed 2 ounces or 1 bottle in 24-hour period.
So there's nothing labeled on there about the concentration of either ingredient.
Total alcohol. Yeah. So it says there's a little bit of iron. There's kava root extract. Total cavalactones are 250 milligrams. Leaf kratom, and then in parentheses it says ground. And then it says total alkalides, 34 milligrams. Mitragine, I'm gonna not pronounce these right. 20 milligrams, and then it said that 7 hydrox mitragynine is
Yeah.
less than 0.05 milligrams.
So there's some labeling at least.
Yes. We have quite a few hands raised too, so I'm probably, they might correct me on some of these. Which is fine, because I know one of the people, Laura Romney, sent a very thorough email with a lot of attachments and information as well. So I don't know if the board has any questions. Like I said, I'm still learning about the product and trying to do my research, and just wanted to bring it sort of as a topic to start discussing.
So do we know what's prompted the other towns to write regulations? And there's nothing at the state level currently.
So no, I know there are at least 2 bills that are in the motions at the State House, but I'm not sure what those entail. I do know that there have been a handful of states that have banned it completely. I think the closest to us is Rhode Island. And what was my other point? From my understanding is when it's in its synthetic form is where it's very dangerous, and has addictive tendencies or dependency. And it can create opioid-like, I guess, stimulation, and so it can be dangerous, especially for younger children if they get their hands on it and they don't use
When
it.
you read the back of the, I was just checking something, actually looking something up. You said kava was also in one of the Kratom's products too, as a combination.
Let me pull that up really quickly.
Because I'm very familiar with kava, and it caught my attention.
It says kava root extract.
Okay. So you sort of have a double potential for central nervous system depression when you combine both of those. That definitely got my attention.
Karen, if I can
Question.
interrupt for a second,
Oh,
can we
sure,
hear
go
from Sergeant Homestead regarding any potential public safety issues or things that maybe the police department have become aware of in connection with the product?
I haven't seen anything yet. I do need to talk to our school resource officers just to see if they're getting seeing anything in the schools. But as far as what we've seen, I haven't seen anything just yet. I did talk to one of the recovery coaches that I've worked with, and she's concerned about the product, but we don't have like any sort of direct correlation with an overdose or anything like that at this point. So.
And so, Lauren, I think you said you had some information about how other towns might be regulating that. Could you give us a synopsis of that?
Sure. I know that Plymouth just met about it this week, so I think they're probably in the beginning stages, like we are. But in Kingston, where I live, they adopted regulations that prohibit the manufacturing, sale, and distribution of kratom products and kratom synthetics. And it sort of talks about violations, definitions.
So essentially, you can't sell it at all in Kingston.
It's not allowed at all.
Okay.
So,
Okay.
I know one of the comments at their public hearing was, well, it's just going to push people to neighboring towns because you can get it anywhere. And that sort of piqued my curiosity, is it in Duxbury? So,
Okay.
and
were there any abuse problems in Kingston? What drove them to?
So what drove Kingston was their state rep, Kathy Lenatra, brought it to the board with their chief of police. I don't believe there were any cases of abuse I was only there for the public hearing when they adopted the rules. I wasn't there for the beginning discussions. But that's how it came about in Kingston, was through their state representative.
Okay,
And
so
then-
they were taking a proactive
Yeah.
stance. Okay.
Yes.
Other questions from the board before we go to some others that have joined us that would like to speak?
Not yet. I'd like to hear. Sounds like we have some people with knowledge on the call. So
All right. How should we do this? Anyone want to put up their hand, Melissa, or do we want to go whoever's in the chat box? Looks like Ms. Romney would like to speak.
We can start with
Should we do with
Ms.
that?
Romney since she sent
Okay.
the email to us. They do there. I think everyone has their hand up, so we'll get to
Okay,
everyone.
lots of hands. Okay.
I'll just go down the line. So I'm gonna allow Laura Romney in.
Hey there, can you hear me?
Yes.
Oh, great. Yes, thank you for letting me speak today. And I'm thrilled that you got my letter and the information I sent you. I definitely would ask that all of you read that and all of the attachments that I did put in there, because it will really, really help you. Let me tell you first of all who I am. So I work with the International Plant and Herbal Alliance. I'm actually a kratom educator, along with, there's actually the two other team members are here on the call today as well that help me teach. But I'm also a kratom consumer. I'm an 8-year kratom consumer. I have a really severe facial nerve disease called trigeminal neuralgia, which I've had for 13 years. And I went through the gamut. I had, over 30 pharmaceuticals, every block you can imagine. I even had brain surgery to release my nerve and a stimulator implanted in my face, in desperation. And I, didn't know what I was going to do. It's like next to impossible to get an opioid prescription. And so I started looking for alternatives. Cannabis was not my, it didn't work for me. It made me really anxious, and it actually made my pain worse. So I heard about kratom, and I thought, well, I'll give it a try, not thinking it was going to help much. But wow, when I took it, I couldn't believe that my pain dropped from anywhere between a 7 to a 9 down to about a 2 to 4 level, which has been an absolute life changing for me. I'm able to work full time and, be a mom and a grandma and volunteer and bowl and walk my dog and everything I didn't get to do back when I was so sick for all of those years. And so I truly, it's a passion of love for me to teach, because it really has changed my life. And I know there's thousands, I know hundreds, I know that particularly personally that have benefited from this. Also, it's a good harm reduction tool. John Shinholzer's on the call, and I know he'll be able to tell you a little bit about that. But what I do want to say is that there is a very, very big, important distinction you need to make between the synthetic 7-hydroxymitragynine products and the natural whole leaf kratom products. The natural whole leaf kratom products have been around for centuries, and used in the Middle East, or I'm sorry, Indonesia area, and have come here about the last 20 years. They've been used in the States. And, there is just really, really amazing how it helps with pain, and it is a great harm reduction tool. But the 7-hydroxymitragynine products, let me just tell you real quickly what that is. So in the natural kratom plant, there is a very trace alkaloid that's, I'm going to call it 7-OH for short. And it's literally in less than 1% of the plant, most often almost not even there. And that only occurs when the product is drying, when the leaf is drying. But these chemists have figured out a way to pull out and synthetically create this 7-OH product, and they've put it into a product that's 14 to 20 times more powerful than morphine. And they're selling it over the counter. And so I can guarantee you, I'm not sure who was it that went to the shops. Did you notice the 7-OH products they look like little blister packs? And a lot of them have names like Opia and Perks and things that allude to narcotics. And so those products are what are causing the majority of problems. And it's what prompted the FDA and the Health and Human Services to have an emergency public hearing on July 29th to tell the DEA that they wanted to schedule these 7-OH products because they are a public health emergency. They were very clear in there. You can look up the hearing. They're very clear in that hearing that they are not after the natural whole leaf plant kratom. They only want the 7-OH, banned from the shelves because that's what's causing the problems. They recognize that there is a lot of health benefits to kratom for a lot of consumers, especially considering there's the opiate epidemic. So I won't go on any further, but I do want to say that we have actually presented our education in a couple of different boards, like Northampton, and we just did Fitchburg last week. Excellent discussions we had. We were able to kind of go through in detail, show you the science. Dr. Sikora, she's on this call today. She can tell you so much about the science. She's a nurse practitioner, retired. And, I just really highly recommend that you let us do that in your next board meeting. You'll learn a lot. We'll answer any of the questions you have. And, it'll really help you setting really good regulations for your community so that people are protected, but yet they still have access to these products. But I thank you again for letting me speak today.
Laura, can I ask you a couple of questions?
Absolutely.
Yeah, so first, thanks for sharing your story. Sorry you had to go through it. Sounds like you went through a lot there.
I did.
So I'm just Lauren talked about the products that are available at the convenience stores, but someone is using sort of the whole leaf product. Where do you typically obtain that from? Or how does it come? Is it just more or less ground up leaves, or how is
Yep,
that?
that's exactly right. So it comes in a couple of ways. It comes in a bag that it's just powder. It's literally just a dried leaf. I noticed that, you talked about smoking. You cannot smoke whole leaf kratom. I know that there is 7-OH products that are vapable and smokable, but again, that's not kratom. It's also sold in capsules. Also is sold in extract format. But it is whole leaf kratom. It's just a concentrated. I know you'd mentioned you'd seen the little shot type bottles that had a couple of servings in it. That is natural kratom. If it has that less than 1% of the 7-OH in it, that is pure kratom. So those are the kind of the formats that they're sold in.
And where do you typically get that? Is it just something you could, I don't know, it's probably a supplement store, or get it on Amazon?
No, you can't get it on Amazon. Typically in communities, it's sold in smoke shops. And also you can find it a lot of times in convenience stores. This is why we're wanting to set regulation for an age restriction, because you do not want your children and teens getting anything like this. You just don't, their brains are developing. So these need to be adult products only in the stores. So again, if it is sold, it's sold behind the counter and adult use only. Like for me, I purchase online just because it's a lot cheaper, and that's just how I purchase mine. But it really is important. In fact, I think there's another gal that's on this call. I believe Misty's on, but she'll be able to tell you about how important it was to have it on the shelves, though, because she walked in and was able to literally get clean off of heroin because she was able to go to the store and buy the product. So it's that's kind of the different ways you purchase it.
Okay, thank you.
You're welcome.
I'm gonna go to John.
Thank you so much. You can hear me okay? Everybody
Yes.
see head shaking. I'm John Schenholzer. I'm a United States Marine Corps veteran, deployed 3 times back in the early 80s, but I'm also a person in recovery from addiction. I've been clean and sober over 43 years, and I'm founder of the largest nationally accredited recovery community center in Virginia, the McShin Foundation, and actually spearheaded peer support service. I heard Mr. Homestead talk about peers in the school, and that I got to, I'm glad to hear that. First of all, I want to advocate for the whole leaf kratom products. And I sent a picture to Lauren just a minute ago. It's in your email. And that's what kratom looks like that's properly packaged. That's the FDA regulatory guidelines for good manufacturing practices. And it clearly says it's been tested. It tells you exactly what's in it, what the alkaloids are. It has the age limit restriction. Don't do it when you're pregnant. How much to take? 2 grams, no more than 2 grams. I think 3 servings a day. And the whole leaf product, these pills, these 7-OH pills that Laura was talking about, these little capsules and tablets, one of those tablets is equal to a paint can, a gallon paint can of the leaf product. That's how far the science has come with this. A 5-pack tablet of 7-OH tablets is equal to a 5-gallon bucket of raw leaf kratom. That stuff has no business being in the marketplace. These vape stores and your tobacco stores that are selling these products, I would bet $1,000 that they're selling 95% of the products they sell is going to be adulterated, or it's going to be a 7-OH product. They don't hardly sell any of the natural leaf products anymore, the powder form. And I think that's a shame, to be honest with you, because the natural kratom product for, I'm going to say, last 12 years running this recovery center that I founded, we've had over 11,000 alumni. So I'm well known nationally. You can Google my name and you'll see all the wonderful work I've done in recovery from addiction and alcoholism. And for years and years and years, if an opiate addict, couldn't get into clinical services quick enough, which before Medicaid, these Suboxone clinics were unheard of. But the opiate addicts, they would always go down to the convenience stores because that's all they were selling back then was the whole leaf products. These adulterated products didn't come out till about 5-6 years ago. The 7-OH came out a couple years ago. But what the whole leaf product does, it acts like a mild version of Suboxone. And it helps people, detox within 5 days, because we actually did a survey in 2016. We took 30 opiate addicts off the streets of Richmond, Virginia, put them in sober living for 1 week, gave them access to the whole leaf kratom products, the powder. And within 5 days, 29 out of 30 of those people successfully detoxed off of the heroin. It was heroin back then mainly. And but come to find out, we were drug testing. We've always done great drug testing in our recovery center. So 12, 14 years ago, kratom was coming up on our confirmation drug testing. And I'd be asking these kids, why are you taking this? Because I couldn't tell they were on anything. And remember, we're in an abstinent-based recovery center, abstinent-based sober homes. And they would say, well, I take it for my PTSD, my anxiety, my ADD. But since then, I've learned that so many people were using kratom as a alternate product to pharmaceutical drugs. They use it to get off of alcohol, meth, crack. I mean, the value of it is really endless. And I've only seen personally 2 people. John Hopkins did a survey of the addiction profile. And it's less than 3%, and I think it's closer to 1.5% for the leaf products. But you can't get addicted to the leaf products overnight. You have to consume, and you can build a tolerance up to it. Okay, if you're taking that product to get a buzz, you can get a little buzz off of it, not a very good buzz. Most addicts, that is not the buzz they're looking for. It's like a 5 milligram Percocet. That's what all the opiate addicts were telling me. But if you get into the process of chasing a high for some reason, or the stimulant effect, it takes a while of taking the leaf product. You got to take more and more and more. But what'll happen, 6 months go by and you're taking 4 and 5 teaspoons. Teaspoon is 2 grams is a teaspoon. You're taking those, but the individual knows that they have a problem. And at that point, everything I know about addiction, alcoholism, we know alcohol has like a 16% addiction profile. I think cannabis has 11%. You know, but you go down the list of drugs you can be addicted to that are very dangerous and deadly. Kratom is the least addictable product. But that's with the exception of these 7-OH pills. Those 7-OH pills that you're selling all across America, coast to coast in these vape stores, to me, they just get high stores. That's your real problem, are these little get high stores. It's not the natural raw leaf kratom. And back in 2015, when they whacked all the pain clinics across America, you got to realize a third of those people were legitimate pain patients that lost their medicine, and they found kratom. And this population, this is the hit right here. People like Laura and Misty, they take the same dose and they've been doing it for years because it solves their problems. They're not chasing the high. You got to chase the high to get addicted to it and go down to, go downhill. Now, and the Veterans Administration, back when these returning veterans were coming back in 2010, 2015, our VA services weren't that good. And these veterans were way over medicated and they weren't getting the attention they needed. Thousands of veterans found kratom, and it really gave them their life back. Now, and here's another hit. In today's drug market, the illegal drugs on the street, we all know that one pill kills. I'm 100% harm reduction 101. Anytime I can get an addict to pivot from a one pill kill to a kratom product, that's a win in my book. Natural raw leaf kratom, there is no scientific evidence today. I mean, proven fact that somebody actually died from the product. It doesn't exist. I think people are definitely dying from the 7-OH products and these adulterated products. And when the DEA, they haven't changed their webpage in 10 years. And there's a 10-minute dissertation on why that webpage looks like that. But it's just, there's so much false information about kratom. It frustrates me and Laura and other people here, but none of us will disagree that these other products that are causing all the trouble, they shouldn't be in the marketplace. But raw leaf kratom products packaged properly to the adult population for appropriate reason, it's the best go-to product Americans can buy. I'm a plant medicine supporter. And, there's just too much options in pharmaceuticals and doctors and prescribing. And there's a legitimate place in our communities for raw leaf kratom powder. And, but I think what other people are doing in Massachusetts, I've attended a couple dozen of these health board meetings throughout the state of Massachusetts. Come to find out, y'all got hundreds of them, by the way. That's a lot of Board of Health in Massachusetts. But when I talk to people, if they've already got their mind made up that it's bad and they don't want to hear what we got to say, it's hard to change somebody's ideology. But when you follow the science and you look at the science and you get your information from the real consumers, the real people, then it makes sense. And there is a gold standard floating around the FDA now. In kratom, natural raw leaf kratom products, they've passed the gold standard for the science to be able to be in the free marketplace. Especially, there's a 1994 DSHEA Act where Congress passed a law that said the FDA, if they can pass an 8-factor analysis test, then you can't prevent them from being in the marketplace. Well, the 7-OH doesn't pass that test. And all these adulterated products, they don't pass it. That's why they mislabel them kratom and kratom products. It's like Kona coffee. You put one coffee bean in a pound of Kona coffee, you can call it a Kona blend, but it's not Kona coffee. I used to live in Kona. I know what I'm talking about. So I know I say a lot of words. I say them quick, but you do have 4 good experts on this call tonight. So please feel free to ask any one of us questions before we hang up tonight, because I want you to have truthful, honest information and not make a knee-jerk reaction to something that's going to hurt tens of thousands of chronic pain patients, veterans, and people that are going to need it. And it'd just be a shame if we just blanket whack that product. Whole leaf kratom products, good. Everything else, bad. And that, thank you so much for listening to me. I'm going to hang out for the rest of the meeting. So. Well, don't everybody speak at once.
Thank you. I'm going to go to Misty Brown.
Hi, good evening, ladies and gentlemen. My name is Misty. I would like to read y'all my kratom testimony. You know how in the AA community, sometimes we'll get attached stigmas like you traded one addiction for another. That's not what I did. I traded an addiction for a dependency. And if anybody wants to call kratom a drug, it is a highly boring drug, if you want to say that. But I would like to read y'all my testimony. But my name is Misty Brown. I'm a, fierce, loud, and proud kratom advocate from Colorado. From 2008 to 2019, I lived in the grip of FDA-approved pain pills, benzos, and muscle relaxers prescribed for my degenerative disc disease. For 11 years, chronic pain management fueled my addictions. It started off as a dependency, then slowly slid into an addiction. This was when the overprescribing epidemic was happening. In April 2019, I was dismissed from my clinic after failing a required pill count. I was 11 pills short, and my usual drug dealers didn't have the pink Oxy-10s I needed. Cut off from the prescriptions, I turned to the streets. While searching for another pain management doctor, I slid into cocaine use. Then in June of 2019, while enduring cocaine withdrawal, I stumbled across the documentary A Leap of Faith. That moment changed everything. The very next day, I began my kratom journey, my whole leaf kratom journey, the very next day, not synthetic 7-OH. Kratom quieted the relentless cravings, the voice that always whispered, one more pill, one more snort, one more escape. It gave me space to address the deeper reasons behind my addictions. I was able to slide my way out of chaotic substance abuse and misuse. I have not returned to pain management over 6.5 years. Today, I'm no longer trapped. I'm a functioning member of society again, a thriving mother, a tax-paying citizen, which I never thought I'd be happy to say that, and a proud first-time grandmother. Most importantly, I'm no longer a burden to my kids. I will be forever grateful that I found safe, lab-tested, whole leaf kratom. Now I share my story, knowledge, and the science behind it to help others facing addiction, chronic pain, anxiety, and depression. I am a survivor of the overprescribing epidemic. Like during my 11-year addiction run that I had, my drug dealers were my doctors, honestly. And I never wanted to admit that I was an addict. I didn't want my drugs being taken away from me, honestly, and it took me getting fired from my pain management doctor for me to wake up out of this 11-year addiction run that I was going through. So like John and Laura was saying, you have to know how to differentiate between whole leaf kratom and synthetic 7-OH. Since 7-OH had been marketed to the community, sold under the guise of being a kratom product in 2023, we have had to hop onto meetings like this. I tell you what, my advocacy has been put through the test this whole year because of 7-OH being mass produced to the public all willy-nilly, and I guarantee you, if you're having problems in your community, it's from the synthetic 7-OH, not from the whole leaf kratom powder. So thank y'all for letting me speak. If you have any questions, I'll be happy to answer them.
Yeah, thank you, Misty. Yeah, I have a couple of questions, not specifically, but for the group, for Laura and John as well. And John, thank you for your input. So I'm just wondering, so the whole leaf kratom, are there sort of regulations or not, or even some sort of guidelines or something? I mean, so in other words, how do you know which product to buy? So how some are better than others, I would assume, or less adulterated, or have less problems. I mean, it's just, today, like for today, there was just an article a couple of days ago for Consumer Reports looking at protein powder, and many of them have high levels of lead.
Mm-hmm.
So how do you know, or is there some process?
A quick answer is the American Kratom Association began a good manufacturing practice program a few years ago. And this is where the legitimate, valuable kratom distributors, they join this association and they have to follow the FDA regulatory guidelines for good manufacturing practice, which include all the testing that takes place. And they went as far as any product shipped out of Indonesia to the United States, they do pre-testing in Indonesia. And there was a salmonella outbreak back in 2018, and that was from a non-member of the GMP program, that the AKA. So if there's an AKA member with the GMP label, they do third-party testing, and there is you can sneak by it. There are a lot of bad actors out there. They pretend to be the good ones, and they're not. But it's going to take some time to really flush out the bad actors with good regulations and enforcement, and even, the fourth tester's got to come along. So it can be manipulated, but the American Kratom Association and their members, they're busting their butts to clean that up. So, for the most part, it's in process, but these other ladies might have even more answers to that question.
So one thing I was going to say is it's actually easier than you think to find out what's the synthetic. Again, you can look on the back of any of the packaging, and it will actually tell you the level of 7-OH on the package. And like I said, if it's anything over 1 milligram per serving, it's synthetic. Everything, it's really not as hard as it sounds. And a lot of the 7-OH products, again, have all these crazy names that sound like opioids, and they come in blister packs. And again, it's not hard. So I know a lot of cities are worried. They're like, well, how hard is this going to be to regulate? It's really not going to be that difficult to be able to go in and distinguish the good from the bad. It's not hard. And is good regulation, again, that we can help you, formulate language and things that, because you don't want to just protect against 7-OH, because now there are more synthetic products that are coming out. There's one called pseudoindoxil, and it's even more powerful, and that's another alkaloid. So we're always telling people, hey, you've got to put in your regulation. You want to, get rid of the synthetic products or the semi-synthetic products. That way you're catching all of the bad guys that could, be coming along.
Thank you. That's helpful. So these companies that produce their product, that go through this testing, then they get to put some sort of seal on their packaging. That's how
That's correct. And not only that, once they enter the program, they are and there's a local manufacturer here in Richmond, the FDA, without warning, can walk into their plant and do a full court press inspection. So the FDA, if they do their job, they inspect these plants, periodically. It's a pretty impressive operation. So it's just, it's work in progress. They're building a plane as we fly it. But our goal is, we hope to see it sold in the GNC stores and the national stores, and get it out of the smoke shops for the most part.
Agreed.
Because those are the get high stores. They sell anything.
Yeah, agreed.
And it's just like, it goes through the same process like the vitamin companies. They go through GMP facilities. So these vendors that are doing it the correct way are pretty much, they're going through that whole same process as well.
Yes. Speaking of which, my generic medications for my blood pressure, they're not. Every now and then they get busted. They're sending me sulfur powder or something sometimes. So
What?
Everybody in this business, top down, has the same problem.
Well, yeah, I mean, clearly the supplements are less regulated than the pharmaceuticals. So that's concern.
I did want to add, I hope I didn't come across as anti-medication for addiction medicine, because, we did pioneer buprenorphine in 2004 over at McShin. It was just a very expensive back then. So, an addiction expert, I believe in anything. Whatever tool is going to help somebody, we use it. So I didn't mean, if I was bad mouthing the addiction word, I didn't mean to do that.
I just happen to find my, recovery path a different way. If I probably ever admitted that I was addicted to the medications and all that stuff, I probably would have went to AA or, got put on Suboxone or methadone. But like I said, you can't force somebody in recovery. It got shoved in my face, and, that documentary I watched is what saved my life. So I consider my stuff PAT, plant assisted treatment instead of medication assisted treatment.
Yeah, Heidi's got great information. I know she's got her hand up too.
Yeah. We'll go to her now. Thank you.
Can I just ask quick, what's this documentary talking about, Misty?
It's called A Leaf of Faith.
Yes, A Leaf of Faith. It's no longer on Netflix. It's on you can watch it free on YouTube.
Okay, thank you.
It's amazing.
All right.
Okay, can you hear me now?
Yes.
All right. My name is Dr. Heidi Sikora. I'm a retired nurse practitioner and healthcare executive. As a nurse practitioner, I served very vulnerable, complex adult and geriatric patients. So I fully understand the challenges of balancing the benefits and harms of pharmaceuticals, over-the-counter meds, and herbal supplements. I have used the natural whole leaf kratom for over 7 years to manage my pain from multiple rare neurological disorders, including a Chiari malformation, tethered spinal cord, and several others. It has allowed me to regain my health, restore my function, and enjoy time with my grandchildren. But I began advocating for kratom regulation after recommending it to a veteran friend struggling with severe pain and PTSD from the Gulf War. It helped him so much that his young son looked up at me and said, "Thank you for giving us our daddy back." Kratom truly restored the function of the entire family. Since then, I've seen kratom help so many others with chronic pain, PTSD, anxiety, and addiction. Many say it's life-saving. So I support appropriate regulations to ensure access to safe, quality, whole leaf kratom products. I think that everybody covered a lot of things that I was going to say, but I want to highlight that we really fight for the Kratom Consumer Protection Act that's been passed in 18 states, and many communities have adopted local ordinances to protect natural kratom while banning synthetic products. And one of those communities, Northampton, recently passed an ordinance. I also wanted to say that Rhode Island did overturn their ban, and so kratom will be legal in April of 2026. The other thing I wanted to highlight is, you read the DEA fact sheet and some of the, reports online, and their information is truly based just on a few case reports. It's not, clinical trials, and so it really does not reflect, the evidence that is out there. And in 2024, the FDA conducted a single ascending dose study. And what they did is, and you doctors probably understand how that works, but placebo group versus the treatment group with the kratom powder, and they put it in capsule form. And over the period of 5 minutes, they had the individuals take those capsules until that first adverse event occurred. And that happened in both groups. And the event was nausea. And it happened at 24 capsules or 12 grams. Just in comparison, I take 2 grams and it's very effective for me. And my brain is so sensitive that I don't like that. I can't stand that high feeling because of my Chiari and my tethered cord and my dysautonomia. I'm already a little bit dizzy. So I don't like anything that makes me feel like I'm intoxicated, and kratom does not do that. So that's just been a real godsend for me. Another thing that I think is important to consider is the FDA recommended kratom be banned in 2017, but that was withdrawn because of the 8-factor analysis that was done, as well as Dr. Brett Giroir. He was the Assistant Secretary of Health at the time. He really wrote a scathing report to the FDA or to the DEA saying that the evidence it was very poor evidence that they were basing that decision on. And his concern was for the unintended consequences of increased overdoses for people that were using it for opioid withdrawal and alcohol withdrawal, as well as increased suicides from those who were suffering from intractable pain who were receiving the benefit from kratom. So I think that those are very important things to consider, and why the natural leaf kratom products are so important to have accessibility while regulating age restriction, and other regulations, to ban the synthetic and semi-synthetic products. Any questions for me?
I do have one question about terminology. I've heard some of the speakers use natural leaf and some use whole leaf. What is there a distinction between those two? And
No,
just
I don't think so. I mean, basically what we advocate for, at least those of us who have spoken so far, is as close to the natural product, as possible, just off the tree and pulverized into a powder and then batch lab tested. So I get my kratom, online as well. I can look at that actual test for that batch. And so when it comes in, they quarantine it, they send it out to be tested, and they do not release it until that test is back. So I can see all the alkaloids, and there are more than 50 alkaloids in the plant, but typically they list the major ones. And I can be sure that there's no salmonella or heavy metal or any other contaminants in that product.
I want to add a little value to that. Some of these, like you'll see a tincture, that can absolutely be natural whole leaf kratom concentrate, a tincture. And over the last few years, these processors, they get competitive. Everybody wants to make a more potent tincture. And I personally think, they went overboard, because if you get a little bottle and it's got like 3 servings in it, or 4 servings, or 5 servings, to somebody that doesn't know any better, that's where some trouble can come into. So with local regulations or state regulation, you can limit the amount, but it's a good thing, because there's a lot of folks that can't take the powder, because of stomach problems or a reflux or whatever. So tinctures are appropriate in a lot of cases. So once again, you don't want to throw the baby out with the bathwater. But with a little bit of knowledge, you can have the cleanest kratom market in Massachusetts. And I did testify in Boston about a month ago at one of those committees. So they do have 2 bills working through the Capitol right now. One is to ban it, and one is to regulate it. And it's anybody's guess, who's going to win, because the anti-kratom people, they're fierce, but unfortunately, it's mainly false information. So we're fighting ideology here.
Well, one thing I was going to say is that we do have an educational program, as in as little as 30 minutes, we can talk about a lot more detail. It's very hard to talk about it in a short period of time, because there is a lot of science that we would be able to share with you. And I know that Laura and John would be more than happy to do that anytime, along with myself.
Thank you. We appreciate that. I think, Melissa, did you get your question answered? I just want to make sure we hear everybody that might want to speak this evening. I think we have maybe 2 others, Lauren said.
yes, thanks. I'm just trying to think through the, what is in the whole leaf product versus, and whether, even with a tincture, you're doing some manipulation of the leaf, right? You are extracting. So
They're using
they use food grade extraction, the same thing they use for food products. And that's a great point, because some of these adulterated products, they don't use food grade extraction material. They use what I consider, bad stuff. So you're correct on that regard. And I lost my thought. You asked 2 questions.
well, that's fine. Yeah, I thank you. That's a great answer now. Thank you.
But the GMP, if you're an AKA GMP member, then you will follow to the T the rules and regulations the FDA puts out.
Great. Thank you so much. Appreciate that, both of your answers. Who's it? Lauren, who's our next person that might want to say something?
Sergeant Homestead, I think, has a question. His hand's
Okay.
raised real quick.
Yeah, sorry, just a quick question to I guess John or one of the others. If this is whole leaf is used as directed, what would you say about operating vehicles?
Well, that's a great question because they actually did a short study on that, and they put drivers in simulators, and unlike cannabis or alcohol, and it was a small study, you know, it might have been like 10 drivers, but it's like 9 out of 10 drove better and more focused than, you know, one of them had adverse driving, you know, but not bad. So as far as the public safety and driving goes, it's like one of the best substances out there. It's incredible, but you know, but I also want to mention the leaf powder product. It has 40 alkaloids in there that we know of, and it has one of the alkaloids acts as a sealing effect. So it really, if you take too much too quick, you're going to throw up, but you can't get but so much effect from it. And one of them doesn't hit the receptor that suppresses your breathing like opiates do. It doesn't have that one in there. And I mentioned that to Mr. Homestead because in case a teenager gets a bag of it, they want to think they're going to throw down 4 or 5 teaspoons for, they're going to be throwing up, you know, guarantee. So, but the driving part, it's really very little effect on driving and kratom, not like cannabis or alcohol.
Okay, but you're saying there's not a lot of studies yet to really say
Yeah,
one
they've
way or
done a
another?
few, and I do know of 2, and I'll actually dig them up for you and shoot them to Lauren.
Yeah, I guess the question is, I mean, I'm not on the Board of Health, but just in considering, you know, if there's going to be advisories, if this is something to say, you know, don't use while driving as recommended or whatever, but that's up to the Board of Health, but just something to think about as.
Well, I think some of the manufacturers they put on there don't operate heavy machinery and stuff like that, just to cover their butt out, I guess.
Okay.
708 could be a different story though, honestly.
Oh,
You know,
by far. Oh,
by
it's
far.
All right.
It definitely has that high. I mean, that's why these abusers are doing it is it's got that high to it. So that's another reason why you do not want people walking off, you know, getting that over the counter, because that definitely can alter driving. In fact, I've even heard people that are pro 708 and they're like, "Oh, well, yeah, make sure you're home at night, you know, on the couch before you take this, because it's definitely not, it will definitely alter you."
They're chasing the nod.
I can tell you from my experience, especially with my sensitive brain, it absolutely improves my driving. And I've been able to return to driving at night thanks to kratom. And that's the whole leaf, you know, not, I don't take anything but the whole leaf kratom powder.
Is 708 is OxyContin on steroids, if you ask me. It's just it's so bad, so terrible. But please just don't confuse it with natural kratom. That, you know, that's one of our messages here.
Okay, we're going to go to Jen with her hand raised. Jen, did you? Oh,
Can you hear me?
yes.
Okay, great. Sorry. Hi, thank you for having this open conversation. I've been loving listening to everybody's kind of commentary. I did want to mention that I'm actually a whole leaf kratom vendor. So if you have any more specific questions to that, I'm happy to answer them. I'm actually local to you guys. I'm your neighbors in New Hampshire. I live right in New Hampshire. I was born and raised in Massachusetts. And I'm really just excited about the possibility of regulation again in another municipality, because I feel like we really do need this. After I went through several emergency surgeries and was left in debilitating pain, and I chose not to turn to opioids because, as you know, it can absolutely destroy lives. And it wasn't something that I was willing to even investigate. So after years of being in chronic pain, when I met my now husband and father of my child, he is an herbalist, and he introduced me to kratom. It helped manage my pain and stay functional. And the thing that I really liked about it, which Heidi touched on, is that it's not inebriating at all. And I will say that as a vendor on the packaging, I do say do not operate heavy machinery, but there was that study that proved that it really doesn't affect you cognitively. I don't know about 7-OH. Like Laura said, it probably does. But I think that's just kind of a blanket warning that we put on for FDA protection, just to protect ourselves if somebody, people are not self-responsible sometimes. So I really just want to impress that there's a lot of science backing that kratom is safe and that we need proper regulations. We need this kind of governing body to make sure that the products that are out there that people have access to are safe. They do have proper labeling. So people understand how to take it properly. And I hope you guys take the education with Laura and John and Heidi. Sometimes I partake in that too. I will send you my position paper on it, and it goes through a bunch of different testimonies from world-renowned experts like Dr. Marilyn Hustis, Dr. Christopher McCurdy, Dr. Jack Henningfield. They have all testified about kratom's therapeutic potential. And across the board, there are toxicologists, pharmacology, and addiction medicine. Across the board, their findings show that it offers relief from chronic pain, anxiety, and even help with opioid withdrawal, which Misty has the most amazing story for that point of view. And it just has a very low, has a smaller risk profile than many prescription drugs. I actually wrote another paper on the comparison of kratom to mat therapy, which I think there's a place and time for mat therapy as well. I think kratom is kind of underutilized and demonized, which is super unfortunate. There's another comprehensive report by the World Health Organization. It's a 64-page peer-reviewed report. And my favorite part of that is on page 39 of the report. It clearly states that kratom was not a causal factor in any of the associated deaths. So there has been kind of this, where I think some of the stigma comes from is people who have had kratom in their system. It has been put on their death certificate that was the cause of death, when in reality, most of these have either been poly drug abuse. One of them was actually a gunshot wound to the heart, but kratom got on his death certificate. It's a very interesting and kind of unnerving situation that it has such a smear campaign against it that people have gone as far to kind of lie on death certificates to really push this out of mainstream. I think we're at 17 states, maybe 18, that has passed the KCPA. And I really am appreciating all of these local municipalities in Massachusetts getting these good regulations. Northampton has the most notable one. And I think Laura probably sent you the documentation with all of the wording and such. So if you're inspired to kind of use their legislation, I think that would be great. I think if you could listen to the science and not the fear and regulate responsibly, I think that's going to do your consumers a great service. And I do agree that it shouldn't be in gas stations and that ideally it should be in GNC and health food stores. That was actually kind of the main reason we started our little herbal company, because we wanted to pull it out of that scene and move it back into the herbal world where it should be, where there's education and understanding and compassion and help when people have questions. So I'm here for any questions.
Yeah, thanks, Jen. I'm just kind of curious. So how does it get produced? So do all the products come from Southeast Asia in powder form, or do they send leaves to America that get processed here? Or I'm just curious about sort of the product, how it's made in the supply chain, that kind of thing.
Yeah, so we receive both. So it's farmed over in Indonesia or wild harvested. We actually do both, and they have their whole process over there. And they have the government actually, if you ship legally, people have to do lab testing first. So it has to be over a certain alkaloid content, and it has to be clean of heavy metals and contaminants before it even leaves the dock. So we receive powder and crushed leaf. And then, like, I don't remember who mentioned it, but it gets batch tested. So it comes in, we pull out samples, it gets quarantined. And when the labs come back clean, it gets packaged, it goes out for sale. Every bag is marked with a batch. And then that batch number coincides with a lab test that my customers can go and look at and see the heavy metal content, the microbe content, and the alkaloid content. But we both have the powder and the crushed leaf. We don't actually process. I don't have the facility. I'm very small. I do have a 2-stage clean room and we have a production facility, but I don't have a giant powder machine where I could take crushed leaf and powder it myself. So we get it set in separate kilo bags, and it's either in a crushed leaf form or it's in a powder form. And we get both because we have a lot of people who really do enjoy brewing the tea themselves, which, as I think John mentioned, some people can't ingest the plant matter from the powder and they prefer the tea. And I think a tea is a great option. It's not extracted. It's your own, you're just brewing your cup of tea in the evening or whenever.
And what's the name of your company?
Wildcraft Herb Company.
It honestly tastes like you lick the bottom of a lawnmower blade. It's so nasty.
It is very leafy.
It's so nasty.
You can make it into a delicious latte, though.
I know.
If you like matcha, it kind of reminds me of matcha. You can blend it up with a little milk and a little honey or maple syrup or what have you, and it can be tasty if you like that flavor. If you don't bother.
If you guys want to know, I'm 6.5 years away from my active addiction, and I only take I take 1 teaspoon once a day, and then I take 1 to 4 days off every week. So I'm not in that addiction cycle where I'm trying to chase the dragon, I guess you could say. Like I said before, Kratom pressed pause in my brain so that it's telling me, hold up, wait a minute, Misty, why are you even in active addiction? So it made me stop and wait and work on my whys. Why was I even in active addiction to begin with? But I'm telling you, if 7OH was available in 2019, I probably would have done that whole "you traded one addiction for another" slogan. Honestly, because
yeah, Misty, did you talk about the ceiling effect? So it has a ceiling effect. You actually can't get less is more with kratom, right? So you can't. If people go seeking with powder, they're gonna get a tummy ache. I like to say that the plant is very intelligent and it doesn't appreciate being abused, and it will make you pay for it, so to speak. Like it doesn't take kindly to that. So again, it's not, if you feel good, you're not going to feel better if you take more. Whereas I don't know what it is with 7OH or other drugs of choice or what have you. I'm sure people, that's how people overdose, is they want to feel better and they keep going and seeking. And there's no reward benefit from taking whole leaf kratom.
That's so true. And because like with me and the pain pills, it was the euphoria I was seeking. And when you took the pain pills, you did take more to achieve that euphoric effect. But with kratom, it's totally opposite. And if you overdo it, that's what we call technically a kratom overdose. You overdo it, you're going to exorcist puke. So stopping it, it's nasty.
Okay, looks like we have one more person with their hand raised. Allison?
Hi, can you guys hear me? I'm trying out some new headphones.
Yes.
Okay, perfect. Thank you so much for allowing me the opportunity to speak. My name is Allison Smith, and I'm the Director of Government Affairs for the Global Kratom Coalition. We are a nonprofit organization that focuses on enacting regulations to ensure that consumers have access to safe and regulated natural kratom products. I do apologize, I joined this meeting a tad bit late because I was in another one. So if this is redundant, bear with me. I'll try to make this as painless as possible. But as we discussed, natural kratom leaf is a botanical from Southeast Asia. It has centuries of safe traditional use, and it's been used in the United States safely for the last 50 years. There are preclinical and clinical studies to support its safe use, including the FDA did a single ascending dose clinical trial back in 2024, which demonstrated that natural kratom leaf is highly tolerable in humans, even at high servings, and approximately 23 million people in the United States report using it today. And the true public safety threat is the novel, dangerous, concentrated synthetic products. This is 7-OH that we keep discussing, and they market themselves as natural kratom products. And just for your awareness, 7-hydroxymitragynine, 7-OH, it occurs in trace amounts as a natural oxidative byproduct of the kratom leaf when it's dried. In contrast, 7-OH are these products where they're lab created, you're taking them and combining them with the equivalent of like pool chemicals, and they have starting levels that are 100 times more potent than natural kratom, and they're 13 times more potent than morphine. These products are the ones that demand enforcement and need protections from. Just as an update, the federal government is looking at putting 7-OH on the schedule. As of July 29th, the HHS, FDA, and DEA announced a coordinated effort to do so. And the FDA commissioner made it clear that this recommendation applies to concentrated unnatural levels of 7-OH, not the natural kratom leaf. And then the state level, that this is a high priority. I was just on another meeting where a tobacco inspector was discussing how statewide this is something that they're going to be discussing with the next legislative session. And then obviously at the municipal level, we have a patchwork of regulations coming through, and we at the GKC really support what Northampton did. Their regulation, they banned synthetically concentrated 7-OH and put adult regulation for natural kratom products. That's the balanced consumer focused approach that we support. And we just encourage, if you guys are considering action, to follow Northampton's lead or follow the FDA's lead and make sure that there is a distinction between synthetically concentrated products and natural kratom products. And again, like everyone else in this meeting, I'm happy to take time to answer any questions. If you guys would like to meet at another time, and we can provide scientific studies, factual reports, we can bring in kratom experts to help with your decision making. So want to be a resource, both short-term and long-term. And again, thank you for letting me speak tonight.
And I do want to add one thing to that. Northampton did pass a great ordinance, but they did not address natural kratom. They only addressed banning 7-OH. And they did say that they are going to do additional kratom regulation going forward. So if they have a great ordinance that you can copy for all of the 7-OH kind of language and synthetic language, but I would definitely add a language about, adults for actual natural kratom, just kratom, adult use only, 21 and up, sold behind the counter, proper labeling, proper packaging so that, you don't have it attractive to kids and things like that. So you could actually tack on to their regulation and make it a comprehensive ordinance that really covers all your bases.
Quick question. First, thank you for everyone input on this and educating us. As far as the natural whole leaf, are these same groups, advocating for FDA approval for medical use? Like similar, seems like a similar narrative to cannabis in some ways. So I'm just curious if that's kind of an end game for.
Here's the problem, Mr. Count, is that Nora Volkov, the director of NIDA, she spent over $100 million studying kratom over the last 10 years, especially at University of Florida. And she testified to Congress that kratom is the best rising tool we have for harm reduction. However, she says, kratom is a plant. A plant can be messy when you go to get FDA a scheduled drug like a 234 or whatever, and nobody wants to mess with the plant. And if they do, it's like a 10-year multi-billion-dollar, project. But at the end of the day, it's the alkaloids that they synthesize, and that's what they're going to make the pharmaceuticals out of. So, but it takes away from the value of the plant matter in the whole leaf medicine that, you know, the citizens probably deserve. Hope that helps.
Well, you can't really patent a natural plant. So there, as far as making a drug, they would have to, you know, change it or, you know, as John said, synthesize it, use, you know, target, you know, one or a few of the alkaloids. But the beauty of the natural kratom plant is that, as Dr. McCurdy often says, that it's like a symphony orchestra, that those alkaloids work together to balance all the effects, and that's what makes it gentle. And it's what really gives it its low, you know, addiction profile. So I don't think that anyone could improve on the natural plant. It's perfect the way that it is. But as far as, you know, the strength for like a pain medicine, the if the manufacturers had applied for a new drug application with 7-OH and done the research, that might have had promise as a pharmaceutical. Unfortunately, they put the cart before the horse, and now the only way to get that off the market is, you know, to do the Schedule 1. So we may see in the future something like that as far as a pharmaceutical. But the natural plant also does not lead to respiratory depression. And that's really important. Whereas the 7-OH does, in initial studies, looks like it does lead to respiratory depression. So that's what's so vital as a harm reduction tool, is that people will not stop breathing on the natural kratom leaf. And as several people have said, that if you take too much, you are going to vomit. So that's another safety mechanism for it. So, you know, I hope that they don't try, you know, to improve on the whole leaf product, because that, in my experience, is the best thing that I've ever seen as far as pain control and the safety of it.
One more question. So if somebody, you know, was striking out as far as, you know, treatment for chronic pain, et cetera, are there certain doctors, you know, like natural healing doctors that recommend this type of kratom treatment plan or anything of that nature?
Heidi, you're the nurse practitioner, that you're perfect to answer that.
Yeah, integrative and functional medicine doctors sometimes will do that. And I can tell you that, you know, I live part-time in Wisconsin, and it was one of the, by the way, the states that banned it, they banned it like in anticipation of that 2016 recommendation, and they just haven't overturned it. So I live part-time in Wisconsin, where it is banned. And you know, and I've even talked to my neurologist, and he said, you know, you should just take it. It's really helping you. And I only take it in Illinois, and I live there part-time so that I can take it, and it has improved my health greatly. So I'm able to take it, you know, 3 to 4 days a week, and really exercise and stretch and improve my balance and my strength. And then I come back to Wisconsin, and I am without it for days. And you know, if I have any kind of exacerbation, I have to get back to Illinois, where I can get it and recover very quickly. Prior to kratom, I was very limited.
I'm not only am I a boots on the ground advocate, I'm also a social media advocate. And some of the commenters that comment on my TikTok videos will tell me that their doctors actually recommended that they try kratom. I've even had just a couple of them say that their doctors actually take kratom, which we need more people to speak out, you know, especially in professions like that.
The VA was highly recommended back in 2015 and 16, And then the doctor, they got some rule you can't recommend something if it hadn't passed FDA approval as an approved medication. So they really, a lot of them cut back on that. But I actually participated in Johns Hopkins clinical trials a couple years ago. And I talked to my doctor about it. And, I'm 67. I got chronic arthritis. I'm the only one out of 10 in my family that doesn't have one or more joint replacements. So I did a gram 4 times a day for 9 months. And man, it solved all my pain problems. And then when I overnight stopped it, my detox, it was ridiculous. I didn't even know what people were talking about. So, but more doctors, they want to recommend it, but for some reason, this is one of those products. They actually, there's oh no, don't talk about it.
Well, they don't know about it. They're not taught, in school, and it's something unknown to them. They're taught pharmaceutical but there are, like, in my pain management doctor, he is very supportive of my kratom use. He says he's got several patients that take kratom. Yeah, patients that take kratom, and he's thrilled. In fact, I only have to go visit my pain doctor once a year for just a very minor opioid prescription for my severe breakthroughs. So he's just like, you're the ideal patient that I don't even worry about because you're taking this. So it's, there are doctors, but then there are still a lot of doctors that are very afraid of it because they just don't understand and know a lot about it. And one last thing too, nobody brought this up, but Mayo Clinic, if you go on Google, if you actually Google it, one of the first hits you're going to get is Mayo Clinic saying how terrible it is. Well, what's interesting is they're just echoing really bad information. Mayo Clinic has not done one single study on kratom, not one in all of these years. And there's nothing to substantiate the claims that they've got on their website. Whereas places like Johns Hopkins University and University of Florida have entire divisions set aside for studying kratom. And like John said, even NIDA has done studies. And so, yeah, it just, again, don't pay any mind to Mayo because they don't know what they're talking about in this particular regard. But just thanks again. I mean, this has been an amazing discussion. You guys don't even really need the education. You got it all tonight. I think if you really were to, want additional education, I would suggest that we do a little PowerPoint and just cover the science because you really have heard everything else. And then, of course, if there's any other help that you would need in creating a good ordinance. And again, even if you create your own based on what we've said, I would love to be able to review that ordinance and just, give you some pointers or say, yeah, add this, take this away to really craft that really perfect ordinance that would be, honestly, it'd be a groundbreaking thing to have an organization like yours to pass just an ideal piece of legislation that could be mirrored throughout the rest of the Board of Health in Massachusetts. It'd be amazing.
Well, thank you. Do we have anyone else that would like to talk before we get on to our next agenda item? All right. Well, thank you all. We appreciate all the information that you gave us, and thank you for joining us this evening. Our next topic is health agent updates.
Sure. So one quick thing I would like to just note, we had a resident of Duxbury and member of the senior center volunteer to help us put away the rest of the files that came back from the digitization project, which was daunting. Her name is Mi Kim, and I just wanted to say again, I just wanted to thank her so much because it was really overwhelming, especially, the reduction in force in our department. So we have everything put away. We're in a really good place now. The next update, I just wanted to go back to the oysters. I know that we had talked about when the oyster beds were closed, what happens to them. And basically they're left to grow. They're not destroyed. They remain in the water until the closure is lifted, and then bacteria levels are safe for consumption eventually. So it was kind of interesting to, I
Yeah,
wasn't really
thank
sure
you.
what.
I did
Um,
AI after I asked that question, so thanks for confirming the AI was right.
Yeah. Then I completed the state code enforcement lead determinator training. I've been trying to get into that for a few years. So that was a good one too. Hopefully I'll never have to use that in Duxbury, but there a couple more updates. The energy storage, I'm sure that you've heard about happening on West Street. I just wanted to note that there was a heavy presence of residents against this project at the select board meeting on October 6th. And there will be an upcoming public informational forum. I don't think we have the date yet. Maybe Selectman Glennon might be able to confirm that. I think the town was still trying to organize something.
Yeah, it had been scheduled for next week. A number of the residents who spoke said it was too early in the day, which makes sense. I think it was scheduled for like 4:30. So the town has taken over the scheduling. We don't have a date yet, but I anticipate we'll have something for public consumption pretty soon, in the next few days.
Okay.
But
So-
there was, Lauren, just to add to what you're saying there, the Board of Health wasn't mentioned specifically, but one of the areas that that I anticipate will be called upon as we work through this battery electric storage issue is the jurisdiction of the Board of Health. I know Mass Association of Health Boards has opined on this issue. And while, as I say, it didn't come up at the select board meeting, I do anticipate that you as a board will hear a little bit more and may at some point be asked to act in some way. I don't know what that action would be just yet. But I want to make sure it was on your radar. As you know, it's a big issue in town, and it's going to be more of an issue, I think, as time goes on.
Thank you. Let's see. We already talked about I had noticed as well that the McNeil landfill capping is on the agenda with the select board on Monday. So I will tune into that. That's with DPW Director Sheila Scarzi, and I think I forget who, maybe somebody from Weston and Sampson. I'm not sure.
Lauren, if I could just add to that,
yes,
there will be a handout that goes with that. I believe I'm just looking at my emails from Monday's meeting, and it looks like there's going to be some material. So I'll make sure you get that so you can share it with the board as well.
Absolutely. Thank you so much. And then last is sort of exciting. Next Thursday, going to the State House representing the town of Duxbury and its continued commitment to public health excellence. It is a statewide celebration to mark the 5-year anniversary of the Public Health Excellence Program, which, as you know, is the grants that were established through the state for shared services. So that, and that has to do with the SAFE 2.0, the Statewide Accelerated Public Health for Every Community Act. So I'm looking forward to that, and I just wanted to share really quickly that has to do with the PHE grant. We see if I can pull it up here. They established a website. Let me share my screen, sorry. That shows all of the different public health excellent grant groups. So here we are in the pink, and if you click on it, it will bring up the name. The entity is the hosting community, which is Plymouth, the towns that are involved, the funds that were awarded annually, and then the different positions that are funded. And then the link isn't working. It's bringing you to Plimpton right now. I guess they're going to fix that. But the collaborative does have its own website now as well, which is here. And show, you know, there's tabs, and it will show the members and the associate members. So exciting stuff.
Very nice.
Um,
So is year 5 fiscal year 26, or is fiscal year 26 an additional year for year 5?
Year, that's a good question.
Don't worry about it. I'm just curious. I thought we were already on year 5 and this is an additional year of funding, but it's not that important.
I know
We're
we're
funded for
funded
fiscal year
through,
26. There you go.
yeah, sounds good. Um, so yeah, that's everything I have. Just continuing to work on complaints. I had a housing complaint today that I think will be coming before you very soon. And I think that's really everything I have for an update. And we actually don't have meeting minutes to approve either. So
Okay. We need ambient dictation so that you won't have to take notes.
So before we go, just kind of question, so about how we want to, so first of all, let me just say, I found that very interesting about the Kratom. I learned a lot. I didn't really know much about that, so it's useful. But I think it's worth considering, looking into this in more depth. So I just wanted to put that out there and just see how we might go about that. I mean, eventually we need a public hearing, obviously, so I think we're not there yet, at least I'm not. But I think it'd be valuable to at least get some more information, have a chance to kind of think through this, see what's out there. Maybe have some people from that group come back and do a session as we think about how to move forward.
Well, do you think, I'm thinking about that too, right? I think that's good point before we leave. I think it might be useful to get some studies. If they're willing to send some studies, would that be a first a start? Do you think that would be a start?
Sure. Yeah, I'd say maybe get some more information from them, and then we can put this on the agenda for the next
Yes.
meeting. Say, okay, we've had time to think about this. Do we want to do some regulations? Do we not want to do some regulations or whatever? And then, of course, we'd have to have a public hearing and all that sort of thing. But if we move forward, but
I mean, I can always look up something in PubMed too. I mean, I know how to do that. So I can try myself to look up some information, and then maybe if we could get some information from the folks, because I believe they said they would send that to us, the folks that presented today, that might be a start.
okay.
I mean, is it, Lauren was just talking about our collaborative. Is there anything we could, any resources we have there? We had wonderful information this evening that said all of those people are advocates for a very specific perspective on this. And I'd like to make sure we do hear other perspectives.
No, I agree. Sometimes when you get these studies, though, there's list of resources and you can tap into the resources that might tap into something else, but then that takes time, right? So, but I hear your point. We need to have all kinds of voices. So yeah, I appreciate that too.
Karen, I just have an administrative question or comment for the board. So you've got a vacancy. Lauren, have we heard of any potential applicants for that seat?
no.
Okay.
It's for like
And the reason I bring that up is my experience has been that some of the best people we get are by recommendations. So if you as board members are aware of folks in the community who might be good additions, please reach out. Sometimes folks just need a tap on the shoulder rather than, stepping forward on their own. And the Board of Health is a pretty important board, as you know, in town. And I want to make sure we have full strength going forward. So maybe do a little recruiting if you can. And I'd like to get somebody appointed to help to shoulder the burden here. Thanks.
Is that vacancy for the alternate, or are we? Okay.
Yes, alternate.
Other items?
Nope, that's all I have. We don't have any minutes to approve.
Okay. All right. Well, thank you. This was a great meeting. Thank you everyone for your time and attention. And I make a motion to adjourn.
Second.
All those in favor? Aye. Everyone is unanimous. So noted. Thanks everyone. Take care and have a good rest of your evening.